Good day. This is margarettedivinemiel from University of Makati College of Allied Health and Services. The next picture I am presenting is a patient that has a hypersensitivity reaction. And the next picture that I am presenting is a concept map regarding what is all about hypersensitivity reaction. Hypersensitivity reaction characterized as four types of reaction, such as type 1 anaphylactic hypersensitivity, caused by IgE and manifested by mast cell degranulation, lead to release of histamine, can have anaphylaxis and skin reaction. By these two, it is risk for ineffective airway clearance. Type 2 is cytotoxic hypersensitivity, caused by immunoglobulin G and immunoglobulin M complement. Will manifest complement fixation, lead to lysis of cells, which is characterized as phagocytosis, lead to the destruction of T cells. Lysis of cells can have ABO incompatibility and drug-induced hemolytic anemia, which is risk for infection. Type 3 is immune complex hypersensitivity caused by antigen immunoglobulin M or immunoglobulin G complex formation, lead to deposits in the membrane of vessel wall, then transmit membrane of glomerulus tissue, lead to tissue damage, and it is manifested in SLE or systemic lupus erythematosus, which is risk for infection. The last type is cell-mediated hypersensitivity, manifested by 24 to 72 hours after exposure to specific antigen. It's caused by synthesized T cell, processed by lymphokine release, attracts macrophages, then will release lysosome enzymes, end up with local tissue damage, which is manifested in tuberculosis and transplant rejection. This too is risk for ineffective airway clearance and is also risk for infection. Hypersensitivity reaction is manifested by flushed skin, light tenderness, edema or swelling, rashes, itching, rhinorrhea, and respiratory difficulty. The nurse will assess vital signs, level of consciousness, nasal flaring, wheezing, capillary refill, skin color, and edema. Then, having those manifestations, the physician will request labs and diagnostic procedures such as skin test, urinalysis, CBC, PFT, RAST, Coombs test, blood typing, and immune complex assays. After doing those labs and diagnostics procedure, hypersensitivity reaction will treated by immunotherapy, antihistamine, corticosteroids, anticholinergics, cromolyn sodium, leukotrienes, autoantagonists, and plasmapheresis. And some of the intervention that the nurses will do is control present allergy, control environment, and provide effective intervention. And those are some of the ideas in hypersensitivity reaction. Hope you gain some knowledge about it. Thank you for listening and God bless.